Thank you, Mr. Chairman. Madam Secretary, one question that I would like to ask, follow a request. I'd like to submit for the record 2 questions regarding community pharmacy efforts to get detailed answers in writing that I'm sure will exceed the 2.5-minute limit here. We'll provide those to staff. But the question that I have, and it very concerns me greatly on the National Connector model, we have tremendous local solutions that are being developed. In particular, a gentleman named Chris Goddard, who runs Health Point, a community health center network in northern Kentucky, has developed a plan working with small business owners that will remove the majority of our uninsured or underinsured in northern Kentucky entirely off the grid of the federal system, providing a physician home, providing preventive dental and medical services and some acute care, not catastrophic, but at the cost of about $50 per employee per month. And I'd like to hear your thoughts on having solutions like that that are locally driven, have the accountability in the network that is key for success in healthcare, as opposed to the one-size-fits-all plan that we've heard so much about over the last couple of months.
Congressman, let me assure you there is no one-size-fits-all plan. There's no national health plan that's been developed or written. And, in fact, the more strategies that are successful at the local and state level, the more people will have coverage that they enjoy and benefits themselves and their families, and the more provider support there will be. The effort for health reform is aimed at stabilizing just that market. So if you've got a strategy that's working in Kentucky that is insuring previously uninsured folks, I think that not only will it not be disruptive, but hopefully will help lower the additional costs that those individuals, those Kentuckians are paying for the uninsured care that's currently coming through emergency room doors, and stabilize that market. This effort is primarily aimed at either those individuals who are paying out of their own pocket for catastrophic coverage, have no prevention care, for those 50 million Americans who have no access to health insurance at all, and for a system, frankly, where the costs continue to rise.
I think in that case, Madam Secretary, it would be well served both for the country and I think would be illuminating. I'd like to invite you to personally come to northern Kentucky, to Covington, and to see some creative solutions that have been developed out of that old saw. The greatest source of inspiration is desperation.
I'd be glad to do that, and Cincinnati's my hometown, birth town, with my dad and sister still there, so any opportunity to visit Covington provides a trip home.
Fantastic. Thank you.